We welcome in a guy who's become a mainstay here on our crew. It's Dr. Matthew Howie, Medical Director of the York City Bureau of Health, who joins us here this morning. Dr. Howie, always good to have you aboard.
Hey, thank you for having me again.
I wanted to play something the governor had to say yesterday regarding the May 31st opening date here, kind of getting rid of the regulations. I wanted you to listen to this, and I just wanted to get a little conversation about this to start. So here's what he had to say.
We all decided that May 31st, midnight on Monday, Memorial Day, would be the day when we lift those restrictions. And that was a bipartisan, the task force. We had a lot of conversation about it, but that was the day we picked.
Yeah, he said we all decided, and he said it was a bipartisan task force. And I would say probably the elected state assembly was not really involved in that. A lot of people have questioned why May 31st, 12:01 to open it up on Memorial Day as opposed to tomorrow, which is really kind of the beginning of the Memorial Day weekend when a lot of businesses are trying to recoup some of the losses this last year. They start the unofficial start of summer. A lot of them say we could fill our hotels. I suspect there are a lot who are going to do that anyway, but I wanted to get your thoughts from a medical professional. I don't want to really inflict politics into this, but I do want to get your take on that in terms of the logic and what difference it would make from Friday until Monday. Your thoughts on that?
Well, I think that there's a caution. I wasn't part of that conversation, obviously, but there's a caution when it comes to social gatherings in broad strokes. We have definitely seen when people don't socially distance, and honestly, when alcohol is involved, we see incidents of transmission of COVID go up. And so I suspect that was part of the conversation. We're at a critical phase right now where we're seeing a decrease in cases, and I don't think anybody wants to mess with that. So I think it was out of an abundance of caution they picked the days that they picked.
And yet at the same time, I guess, and this is where the logic kind of escapes me a little bit, maybe you can help me, where we are going to gather on Monday. There is going to be alcohol on Monday. There are going to be people opening up swimming pools and all those kind of things. And so, I mean, we still have that. It's just the idea of the length of time, the period of time of an entire weekend as opposed to one day. I'm not sure I'm seeing the logic, but maybe you can explain it in a way that I'll understand.
No, I think it's all about messaging at this point. I think that we don't want to discount what are very effective measures at controlling the spread. When we pay attention to social distancing, when we wear masks, when we can't pay attention to social distancing, and when we do vaccination and effectively do vaccination, we see a remarkable decrease in this disease. No question about it. Mm-hmm. And I think it's really just finding a way to have that message still resonate. And I think there's just a challenge when it comes to holidays in particular. We definitely have seen bumps after other holidays.
Okay. Let me ask you this question. Do we have a type of herd immunity already built in? I think you and I talked about this, and I know I ask you this terminally every time, but do we have that before the vaccine even kicked in? Obviously, now that's been sped up and reinforced by the vaccine. What's your take on the whole herd immunity thing? And, of course, 70% is the number that's looming out there to get rid of the masks and whatnot, getting 70% of adults vaccinated. Your thoughts about that?
Yeah, I mean, if we had waited for just natural infection to create herd immunity, it would be an extraordinarily bad thing in terms of number of infections, number of deaths.
Right.
There's just no comparison in that space. Herd immunity from natural infection there's a contributing portion of natural infection to our global herd immunity. Mm-hmm. Bodies don't necessarily care where they get the antibodies from, whether it's natural infection or it's the vaccine. The vaccine's really effective at getting that immune response that we're looking for.
As a medical, go ahead.
No, I was just going to say we've done a good job of doing it, and those two together really are, I think, why we're seeing the curve bend right now in terms of dropping numbers of infections and actually dropping number of severe infections in the hospital, which is nice to see. Yeah,
I wasn't using one to the exclusion of the other, obviously, but I agree with you that the idea of the two together, the fact that people have been exposed to it and people have, gotten through it. And what's the landscape right now for COVID? A lot of people have, stopped wearing masks. I just read one. I'm riding on an airplane later this afternoon. Of course, the mask rule is still in effect there. And I read where they had a kind of a big document come out about people can't act up on an airplane. Apparently people are getting upset when they're being asked to wear a mask on an airplane and so forth, and yet you're in a confined space. I mean, you're in a space. I don't mind wearing a mask on the airplane, but I saw where a lady knocked the two teeth out of a flight attendant the other day over a mask. I mean, are we? What's the landscape right now in terms of where we are with COVID right now? Because it's like some people said, "Hey, it's over. That's it. We're moving on."
Yeah, it's not over. Unfortunately, I would love to say that it is, but it's not. And it's a seasonal virus. So I think we're getting closer to this window where there's a natural decrease in the spread of this infection, and we're getting really good vaccination rates. And the natural temptation is to say, hey, we won. It's done. And the answer for the rest of it is not so quick. Confined spaces, certain areas, homeless shelters, hospitals, areas where we have congregate living, masks are going to be there, and they're going to be there into the foreseeable future. And definitely when it comes to regulations, everyone has their opportunity to set their own regulations as businesses about how they want to handle masks going forward. That's kind of part of this. Once the state regulation goes away, it doesn't change the capacity of a business to make that decision. And I think that's where airline gets in there. We have a trapped space with air circulation, close quarters. There's no way to get 6 feet. Masks are very appropriate in that space. But I think as a population, as a community, a lot of people are really frustrated at COVID over the past year, and I think it's just boiling out at different times. Not a surprising location for that to happen.
We're talking with Dr. Matthew Howie this morning, Medical Director of the New York City Bureau of Health. Dr. Howie, I wondered, as a medical person, you sit back and you watch what's going on all over the country where people are giving lotteries for getting shots. You get a chance to win $1 million if you're in Ohio. Other people are giving away gift certificates to fast food places. I mean, you're getting an array of things around the country. And I just wonder, if people are not going to get a shot, are they going to be lured in by that kind of thing? I saw in Ohio the shots went up 32% when they had this lottery for $1 million. So I guess if you put something out there substantial, people will do that. What does that say about our population? Any thoughts on that?
Well, I mean, I definitely see when we went to real-time registration, so you could walk in, get registered, and get vaccinated, where we shortened that window, we saw an increase in uptake of the vaccine. So I think that their convenience matters to us. And then I do think that there are folks who are on the fence. These aren't folks who have profound reservations about the science. These are folks who are just saying, I don't know, maybe I'll wait. Let's see what happens. And if we can induce them with something that's reasonable, that helps them get over that fence and get over that fear a little bit, or hesitation, or prioritize it in their world, I'll take it at this point. I think it's a benefit to all of us when that happens.
Final minute. What's the biggest concern you have right now here in this moment with COVID? It looks like we're kind of coming to the end, and yet at the same time, as you said, we're not at the end. What's your biggest concern right now as a doctor in this time?
So as a public health doctor, my biggest concern is the fall and the winter. I think that it's going to be difficult for folks to, after this past year's experience, to look at those kind of restrictions that may come back. I wish it on no one. I'm hoping that adequate vaccination really makes a dent in this. But if we do see increasing numbers in the fall and the winter, my hope is that our community can rally around it again, recognizing that all pain stops, all bleeding stops, and there will be an end to COVID. It just may not be as fast as we all want it to be. It's getting better, but it doesn't mean it's a forever better.
Yeah, we'll take a look at it, and hopefully we handle it a little bit better maybe, and now that we've learned some things about it. And again, depending upon the severity of it, all those things we'll be talking about along the way. Dr. Howie, always appreciate your expertise and your opinion. Thank you so much for joining us again this morning.
Hey, thank you for having me. I appreciate the time.
Thank you. Dr. Matthew Howie, Medical Director of the New York City Bureau of Health.